can you please tell me what would you do if you came into your patient's room and you saw that your patient was on the commode and appears like they may have passed out or had a syncopal episode?
Yeah, if I were to find a patient coming into the patient's room, finding that they're about to pass out or they're having a period of syncope, is I would make sure to remain with the patient. First, I would stay with the patient, quickly assess them, see how they're doing, and then make sure if I could possibly position them in such a way where they would not pose themselves to be a fall risk. And at this case, if I find that I need help with positioning that patient or I'm having difficulty ensuring that they're not going to fall down, I would then page the charge nurse asking if they could come over to help me out. So that way the patient safety would not be compromised. And after getting that appropriate help from the charge nurse to ensure that the patient is safe, and after performing those appropriate assessments to determine what caused the patient to have that episode of syncope, it may have been attributed to being in the commode for so long, or it may have been like exacerbated by a long period of physical exertion. So after performing that appropriate assessment and determining the cause of origin and positioning that patient into a safe place, I would then notify the doctor afterwards, letting them know that this patient had an episode of syncope. They were short of breath after using the commode. And then also notifying the doctor and possibly explaining the reasoning as to why it may have caused it. And so that's what I would do in that case.
Don't assume, like, because I think you assumed that the patient was like awake or whatever. Like, all I told you was like they were on the commode and they looked like they had passed out. So the first thing that if you walk into that, you're gonna want to know, like, oh my God, are they okay? Like, do they have a pulse? Are they do have vital signs, right? You know what I mean? So the first thing you would want to do is check for a pulse, get vital signs while you see if they can talk to you, see how oriented they are, see if they can tell you what happened. And like, if you get one of these questions and you completely freeze, you can't go wrong with like getting help and getting vitals and seeing how oriented they are. Like, like if you freeze, like just start with that. And yeah, I think that was good. You were kind of vague when you said assessment. I'm like, do I count that as vitals?
I know. I was like drawing a blank. Come on, you know what the assessment.
I mean, that's technically right, but like, did she like talk to them? Did she take vitals? Did she like, what did she do? For anything where it's like they passed out, you could also check a blood sugar just in case that's it. You definitely want to get them back to bed just in case like something does happen right after that, because you can't do CPR on a commode. You know? Why would you like to be a part of our hospital?
Yes, the reason why I would like to be a part of hospitals, I find that their mission statement of being able to heal humanity through compassion and science has really struck with me, because I find that my personal nursing philosophy is really in alignment with it, especially growing up in the Bay Area and being able to align and working with different populations, different groups of people of socioeconomic status, different identities, and different kinds of people. It's really allowed myself to be able to work with them and get to know these people genuinely. And so to provide care in this population would be something that I would be honored to do. And in addition to that, I always knew that nursing was the path for me. And so to take these skills that I've acquired from my volunteer work and clinical experience and apply it in a setting where I find myself so passionately immersed into the mission statement and the values holds, I find myself really thriving in this learning environment and this work setting. And so that's why I would be very much interested to work.
I don't know if you like that they're magnet or if you like their focus on empowering nurses to kind of advance the profession through education and like excellence and care? Like, what is it specifically about the mission statement?
Yeah.
You know,
Okay.
because like mission statement and compassion, it's kind of like a cloud of buzzwords. It's like you could do
Yeah.
something like this that specifically speaks to you,
Mhm.
that would give you like some extra points.
Oh, for sure. Yeah. No,
Yeah.
that's right.
Okay, so can you please just tell us a little bit about yourself?
Yeah. So a little bit about myself is that I just recently graduated with my BSN, and to go more into about myself, I always knew that I wanted to be a nurse ever since I was a little kid. I've been always fascinated by the sciences, and I always had a passion for helping out other people. And so to find a profession that was just this perfect hybrid of helping out people while also being in a topic that I was very much interested in, I felt was the perfect combination of that. And of course, I had an amazing role model with my mom, who was a nurse, and seeing in her how she was such a healing presence for her patients, and um, hearing these qualities of advocacy, resiliency, and compassion for her other patients, I realized that I wanted to carry those other qualities as well into my profession. And when I was in high school, I always found myself excelling and thriving in topics like bio, physio, and anatomy. And it just really sparked my interest in those topics. And so finally being in nursing school, where I got to go through all of these different clinical rotations, I felt that having that foundation really helped me out. Um, and so it was there were particular clinical rotations that really struck with me, and that was my med surg rotations and my preceptorship. And it was in these particular units that I found myself really thriving and enjoying learning from these different populations, working with them, with all the different team members and all of the moving parts. And I think that was during that clicking point where I recognize that those are the kinds of patients that I want to work with and serve. And so I'm really looking forward to sharing these stories about these different kinds of people that I've worked with, and so I'm really looking forward to working in that population. Okay.
You say med surge, they're gonna be like, oh, is she med surge nurse? Does she not want, like, I was waiting for you to say that you liked the step downs, because you're not interviewing for med surge, are you? They're mostly step downs, right?
Like they describe it as like an adaptive unit, so you're taking care of like both acute and
Okay.
step down patients. Yeah.
And I like that you seem to kind of like the fast paced environment. That makes me think like you don't shut down and get overwhelmed.
Mhm.
And then
Yeah.
again, I finally felt like you had a moment where you were just kind of honestly talking and it wasn't like pageanty. So I feel like that's good to just right off the bat,
Mhm.
like let them connect with you, let them see your personality.
Okay, for sure. Yeah, like what would you say like out of like the particular questions that felt a little bit too like rehearsed or like on like that pageantry
It's
vibe?
sometimes just your wording. It's
Yeah.
things where you say, and as a result, or like, and in that way, I learned it's like sort of the phrasing is very like, it's not the way that you would talk like to your friends. It's
Hmm.
hard because you're like in a professional setting too, so you don't want to be super casual, but it's almost like the wording sometimes is too polished,
Okay.
where it's like you're almost keeping a distance from them in like
Hmm.
sort of a professional type of way, and
Yeah.
it's like doesn't really let them see the genuine you.
Okay,
It's
for sure.
not like what you're saying, it's sort of like the phrasing that you
The
use.
phrasing. Okay. Yeah, like okay, like my thing is like when I'm like especially since like I've had like these stories in mind, like when my mind draws to blank, it kind of defaults to like using like these formal transition words. And I guess like something I'm curious about is like what are like good like conversational filler words to use so that way like it breaks out of like that pageantry tone or like
Maybe you could
delivery.
just focus on just like with your intent, like making sure it comes across that you're just like genuinely sharing with them, and like, because
Hmm.
even if like the words are, because you could say like, and as a result, such and such versus like, and as a result, and like if you're like expressive and like really showing your genuine personality when you say it, I don't even know if like the formal kind of wording would matter.
Oh, okay. So is it like mainly like just like the delivery of it and like what words follow after it then?
See if you can like watch back and catch a little, like you'll see the difference between times when it feels like you're like just genuinely being open and connecting and like spending time letting them get to know you versus
Yeah.
where it feels a little bit more like distant.
Mm-hmm.
I
Okay.
can't put my finger on exactly what it is, but you really do want them to feel like they connected with you specifically, because then they'll
Mhm.
be like, they feel like they know you, they'll be pulling for you, versus if they feel like they never really actually like you never really let them in, then it's like,
Mhm.
oh, like she did,
Okay.
her answers were good. I don't
Yeah,
feel like I got to know her.
I see.
No?
So like they definitely want to feel that connection
Oh
if
yeah,
like okay.
yeah.
Oh my gosh, for sure. Okay, cool.
Yeah.
Because
And you
like
look
yeah, I was
reasonable and likable. Like if you just be yourself, I think it'll be,
yeah.
yeah.
Okay, cool. Yeah, because I was like a little bit trippy because when I was like asking my friend how like the interview went, like I was like, oh dang, like my preceptor was right because like there was like instances where like she would have people like who would try to one up her answers. So I'm like weary of like people like trying to like pin down my answers or something. Like yeah, like knock me down or like, oh, I saw a patient who was unconscious and I immediately started compressions and yeah, there was like definitely people who tried to like have these over the top answers.
The thing is, like, nobody wants to work with that person.
Yeah, I felt that too. I was like, I don't think they'd want to hire him if he's like trying to put you down for that.
If
Yeah.
somebody do that, I'd be like, thank you for making this decision easy for me. I never want to see you again.
Yeah.
Like,
I never-
cool, done.
Yeah, okay.
Yeah. That's not like nursing as a team sport where you don't throw each other under the bus.
Yeah.
That would be an immediate no.
Okay.
Yeah.
For sure.
Don't
Okay.
worry about those people.
Okay. Just focus on my answers and just developing that connection.
We have a lot of great candidates. Can you please tell us why we should choose you?
Yes. So why you should choose me is I find that a lot of my experience through my clinical rotations and my work and my volunteer experience that has really oriented me to work in very people-based jobs to align myself into preparing for a profession that is going to be working with different kinds of people, utilizing qualities of teamwork, compassion, and resiliency would allow me to best thrive in this facility. And I believe that I would be able to excel in this because of these qualities. Through my preceptorship, I have found myself developing qualities of working well with team members, being able to demonstrate compassion, having the continuous resiliency to come back with each shift, eager to learn more, even after those times of difficult patients or difficult moments of questioning whether or not nursing is a possible thing, but seeing how I'm able to actively renew my love for this profession and for this line of work is the reason why I'm so eager and so passionate to work on this. And even as a new grad, I have the passion and the enthusiasm to continuously work and be receptive and open to learning. And so that's why I find myself to be a very much qualified candidate to work here and to be chosen.
When you said the thing about, I forget what it was specifically, but what I heard was like that nursing is difficult and the patients are difficult, and like to even come back even after those shifts, I'm like,
Yeah.
whoa,
Okay.
girl hasn't even started working and she's burnt out. Young blood. You
Oh
know,
my gosh. You're like, I don't know about her anymore.
I wouldn't go there.
Okay.
If I'm speaking honestly, I feel like something you could talk about is like you have really good communication skills. And I don't think
Okay.
you've brought that up. Like I don't know if you'd say it as openly as this, but like people like you and you get along with people and like you're good to have on a team. Like, so
Mhm.
I think the way that's like non-braggy to say that is that you thrive in a fast-paced environment where you get to collaborate with members of an interdisciplinary team and strive to be the strongest teammate on the floor that you can be, and really use your communication skills that you've developed to help boost morale, even on shifts where, you're short-staffed. And that's really helped you to maintain a good flow on the unit and develop your relationships with your coworkers.
Okay.
Something like that. I don't know.
Oh, I like that. Yeah.
Because I feel like that's like one of your strengths.
Oh,
yeah. Do you have any hobbies that you enjoy outside of nursing, and what does your self-care practice look like?
Yeah, so hobbies I have is after graduating, I found myself having a lot of spare time to definitely be focusing on self-care habits and things to focus on for myself. And one thing in particular that I've redeveloped my interest for is doing karaoke. I like to sing, especially every weekend. My mom and I would like to open up the karaoke setup and we'll just jam out to a bunch of 70s and 80s song. And although I don't think I can carry a note, I like to tell myself I can once I'm singing into that microphone. So that's one thing that I like to do as a hobby, is getting into karaoke. But yeah, that's like a part of my routine, is just getting into something that allows me to be in a total other element and to just shift all my focus from all the extraneous or external things that may be going on in my personal work life, and to just focus on that and to really let myself loose with music. And so that's my hobby.
I hope they ask you that, because if you watch back, you can see like that was like a really genuine moment.
Okay.
About that was great. Can you please talk about a challenge that you have faced and how you overcame it?
Okay. Oh, wait, quick question, Mary. For that one, do I give a story for that, or is that like a general like quality
for the
like
challenge?
Yeah.
Yeah, like I've heard people talk about like an illness that they overcame and how it taught them about nurses and what nurses do and how impactful that was to them, or like they moved from another country and like learning the language, it taught them to like ask questions and to like be open about mistakes that they're making, and like, or like anything that like personally you've had to overcome, like a big change in your life, or like if you've ever moved, or like if you, I don't know.
Yeah. Oh, okay. Because like I'm thinking and I'm like, okay, well, like a challenge that I went through, like I think it's like, I don't know if it's like too generic, but I'm thinking like, okay, well, like I've been through nursing school, like I've worked with like difficult nurses before, like nurses who weren't necessarily like the kindest, but I'm fearful like that, yeah, like that might be a red flag to mention in an interview.
It's just people have so many opinions about it. And like lately I've noticed a lot of people have the opinion of like, oh, young people, like they can't take criticism anymore. They think like any kind of constructive feedback is bullying. Like not all
Oh,
feedback
really?
is bullying. Yeah, there's like, it swings back and forth between like, we really need to provide a supportive environment for new grads, to like, new grads need to be able to accept that you can be a good nurse and also make mistakes and like be able to hear the feedback. There's people I've seen, they're like all over the map, and you never know how the person that you're talking to is gonna like where they are.
To that, yeah.
Oh, could avoid that.
I know, because like that's like, I mean, I probably sound like such a bland person right now, but like I haven't had like that moment where I needed to move and like do something. But I feel like that's just like such a striking thing for me, is like, I've had like clinical instructors that like kind of shredded me apart for not like being possible of providing patient care or something like that. But
what about like a team sport? Did you ever do a team sport where you learned the importance of teamwork and
I did like
people's needs or whatever?
Oh my gosh. I wish I was like an athlete. No, I like did volleyball and basketball, but that was like in 5th grade.
Talk about it. That doesn't matter. You don't have to say it's 5th grade. Say that you played multiple team sports growing up, and that just talk about like, I don't know, any kind of challenge, like, I don't know, like you have to be tall for basketball, right? Say like basketball was challenging because you're in the
I'm
sports
like
side
a midget.
but like you're really glad that you pushed through it because like the teamwork and knowing how to like make changes quickly based on what's going on as a team was actually something that really helped you as an adult when you have critical situations going on with patients, and to really know what that flow feels like to pull together as a team for a common
Yeah.
goal. Like you could use that.
Oh, okay, for sure. I'm just not gonna mention like when I did.
He's like, I was even shorter then.
Yeah, I was like what, like 4'9"? Like I was like tiny.
Yeah,
Okay.
boom, there you go. Okay. Um, can you how would your last manager describe you?
Okay. When I say like when it's like asking my last manager, is that gonna mean like could I apply it to like a supervisor I had from clinical, or is it saying like actual manager from work?
Basically, what they want to hear from you is that you're super dependable and reliable, and then
Uh-huh.
whatever else you want to say.
Oh,
They're
okay.
basically asking like, are you the problem child who's like always late and like doesn't show up and like is always in like getting disciplinary action or whatever, you know?
Yeah. Oh, okay. Like so when I say that, like do I describe it like, oh yeah, like my manager from work described me as this, or like could I say like, oh yeah, like my preceptor who supervised me during like my capstone?
You could say, I guess my last supervisor type role would be my preceptor, and my preceptor um, mentioned that I show up early every day, ready to go with a great attitude, that I was really dependable, and um, they said that with the short staffing, they really I don't know how you say this without sounding braggy. Basically, what I'm trying to say is that like they really enjoyed having me around, um,
Mm.
to to help with the short staffing and be a member of the team to help with the flow on the unit. But like I don't really know if you can say it like that without sounding too braggy.
Oh, okay, because it like might come off like too like cocky.
Yeah,
Right.
exactly.
Oh, okay.
But yeah, do you want to try something along those lines? So what would your last manager have to say about you if we called them and asked?
I would say my last supervisor or manager would be my preceptor for my capstone. And ways that she would describe me is that I would always come to the shift early and prepared with just the great attitude of being receptive to learning and being open to providing care. And she really appreciated my willingness to learn, especially in cases where we would be short staffed and I would be willing to take on the help of helping out other team members or asking others if they need any assistance. And so that's something that she would mention about me is my ability to be a dependable person that I'm able to be relied on for other things with tasks that may be overwhelming to a team member that I would be more than willing to take on. And so I think it's just overall my willingness to be a team member and work well with others.
Perfect. Cool. What would you say are your biggest strengths and weaknesses?
Um, my biggest strengths, I would say, oh wait, quick side question. Do I start off with like when I'm answering this, like should I start off with my weaknesses or do I start off with my strengths?
I would say whichever one they listed first and just
Oh,
give.
whichever they listed first. Okay. Um, for my biggest strengths, I would say one of them is my ability to work well with others. I'm able to understand the team dynamics and develop a good relationship with team members and recognize the needs of a certain team and being able to address them as needed. Another strength of mine is that although I'm a new grad, I am very much enthusiastic and passionate about learning and being receptive to feedback and growing in this profession. And so I'm really looking forward to all of the learning opportunities that may come as I'm working in this job. And for my weaknesses, I would say that my new grad, being a new grad, can kind of serve as like this double-edged sword where although I have this passion, there is that possibility of me being uncertain with how to handle things and handling uncharted territory or uncertain waters for me. And so really being able to take that as an opportunity to use that as recognizing my resources and being double safe if I don't know anything, to make sure to ask the question and to know who my resources are. And so I would say that's my weaknesses insofar as just having like the lack of experience and confidence to be able to handle those different situations.
Cool. That works. Where do you see yourself in 1 and 5 years?
In 1 year, I see myself being a confident, passionate nurse who has developed the skills and the qualities that I envision myself to be right now. So just to be that very well-seasoned, qualified nurse. And in 5 years, I definitely plan on taking those skill set and possibly pursuing further education and getting my master's and seeing if I could possibly pursue leadership roles or leadership or management roles, and seeing where to go from there. But it's definitely being able to continuously acquire the skills and knowledge that I've gained over the years. And that's where I see myself.
Did you say anything about becoming like a preceptor or becoming a resource on the unit?
Oh, that's a good one. No, I didn't, but I should definitely add that. Yeah.
Yeah, resource. You could talk about wanting to become a preceptor, wanting to become a charge nurse.
Okay. Yeah. Would that be like in the 1 year mark or
No.
like the 5 year mark?
You should talk about wanting to become really confident and solid in your skills so that, at the 5 year mark, you could then become a resource to others as either a preceptor or a charge nurse, and that you would love to become involved in any kind of committees to learn about different projects focused on improving patient care that are going on within hospital to then bring back to your unit. And yeah, that you want to become a charge nurse, preceptor, and that you would also love to get any kind of certification like a PCCN or anything like that.
Oh, okay, cool.
PCCN is like the step down specific one though.
Yeah, I think it might work because like if they're like a combo of med surg and step down.
Yeah. How would you handle your emotions when a patient dies?
How I would handle my situation when a patient dies. I think that's it's such a deep, tricky question to handle when dealing with death. But I think one of the important things is to first acknowledge my emotions and recognize that because I've developed this relationship and rapport with the patient, and knowing that death was the result of it, I think it's very important to be in tune with myself and as far as how I'm feeling about this situation. And after being able to check in on my emotions, I think another important component is to look into the resources that your facility may have, and as far as the support or guidance they may provide when handling these types of situations, especially when it comes to death and grieving. So I think those are two components, is to just recognize my emotions and take the appropriate measures and acts to help grieve and how to identify those emotions and how to move forward from it.
Okay. Can you please tell me about a time when you had to give feedback to a coworker?
Yes, a time that I had to give feedback to a coworker. This was during a time when I was on a second shift with my preceptor during my capstone, and the charge nurse was requesting that I go see a patient who immediately needed help. And so, because my preceptor wasn't present with me to come with me to check in on this patient, and I didn't know much about the condition of the patient, how severe the quality was, I had to kindly let my charge nurse know that because I'm only on my second shift with my preceptor and I'm yet to be more involved with patient care experiences, that I need to wait on my preceptor first before I go ahead and check in on the patient, in order to ensure the patient's safety and that I'm able to handle that matter appropriately. No? Okay.
Oh, basically what it sounds like is your charge nurse said, "Hey, this patient called. Can you go check on them?" And you said, "No, I'm not going to check on a patient."
Oh, okay.
But like, what if they just want water? What are you talking about? You know?
Yeah.
Have you ever, because we mentioned earlier you had like CNAs that talk to you in a way that wasn't appropriate in front of patients. Could you maybe talk about that? How you told
Oh,
them like
okay.
what they said, kind of like illustrate, like paint a picture of how inappropriate it was in front of the patients, and that you asked them later, letting them know that you're super, or like you think it's great that they are taking their time to help you and share their experience with you, but you need it done, at the right place in the right time. And
Mhm.
it's better to not have that feedback given in front of the patients because um, it can affect their relationship and their confidence, like in the care team,
Mhm.
something like that.
Oh, okay.
Because that happened, right?
Yeah, like totally where it's like PCA is like, no, you're not doing this right. What are you doing? Let me just take over. Like, yeah, there's been instances of that. Yeah. Okay.
Can you please tell me about a time when you had to give feedback to a coworker?
Yeah, a time that I had to give feedback to a coworker was when I was with a nursing assistant and we were helping change a patient who just had a bowel movement and change out their bed linens and clothing. And while I was helping out the PCA remove the bed sheets, she quickly tells me, "Oh no, you're doing this wrong. You need to remove that bed sheet, and I can go ahead and take over. You can leave the room." And so quickly, I felt very taken aback by this remark because I wasn't sure how to handle that situation. But after much thought into it, I then, after the PCA or the nursing assistant was able to help with the patient, I then let the approach the PCA or nursing assistant, letting her know that I was very much thankful that she was able to provide me clarity that I wasn't doing a certain task or skill set correctly. But I would have appreciated it had she let me know about ways to improve it with the patient not being present or at a more appropriate time. So that way to not disrupt the relationship and the confidence that the patient has in me. And so that was an instance of needing to give feedback to a coworker.
Okay. Yeah. Be careful not to like impersonate her voice in a way where you're like mocking.
Yeah. Yeah.
Because like just what she said alone is like enough. What would you do if your shift replacement did not arrive on time or at all?
If my shift replacement didn't arrive at time or not at all, I think that this is a matter that needs to be handled where I can let my charge nurse know about the situation, letting her know that the person is not here yet, and if possible, being able to type down the report or um, place the communication by either typing it down or letting a fellow colleague member know, especially if the team member is running late. I can let the team member know about the current handoff or report status, and that way she could relay that to the team member who is coming in late. Another possible option I can explore too is just simply staying in a little bit later. Um, just providing care, extending my shift so that way patient safety, patient needs are being met because the patient hasn't, or because the colleague member hasn't still come in yet.
So in the scenario where you type down a report and then you leave, who
Mhm.
is taking care of the patient when you're gone?
The charge nurse?
Potentially. So I feel like the answer that they would want for you to say would be, um, that you,
Yeah, we ended up just waiting. Yeah.
so you could say that that actually has happened, that somebody called in and said that traffic was really bad and they weren't going to be able to arrive on time, and that you let them know, just get here safely. We can keep the patient safe until you arrive. Um, and then you waited until they arrived and then gave them a report and made sure that there was a safe handoff before you left, and that you understand that things happen, and the most important thing is to just keep the patient safe and make sure that there's a good handoff. And if it was, a situation where someone would be significantly late, that you would work with the charge nurse to see if it's more appropriate for you to stay and do overtime, or would it be more appropriate for the charge to get report from you and take the patient, and then you would just do whatever is best for the flow of the unit and the safety of the patients that are on the unit at the time.
Okay.
So can you please tell us about a time where you were able to provide culturally conversant care?
Yes, a time that I was able to provide culturally, could you repeat the word again? Conversant care?
Did we talk about that, like competent versus conversant? So like a
Um,
lot of them say like culturally competent, but they've been trying to educate us that like that kind of makes it sound like you are now proficient in culture. Like
mm,
the idea is like there's always going to be new things to learn about other people's culture. So it's better to say culturally conversant, because it means that you're able to kind of like facilitate an exchange where you can be open and learn, rather than like, no, I know about your culture. I know all about it. I'm competent. Like,
yeah.
you know?
Oh, okay, gotcha. Yeah. Yeah, I remember like we were kind of struggling with like finding like the appropriate answer for that, because it was like the most I did was like, okay, I used a translator, or like I talked to the family member to translate. Um,
Did you ever find somebody like the kind of foods they like, or bring somebody like a lot of hot water and warm blankets, or like,
oh yeah, well like there would be like an Asian lady, and I'd be sure to bring hot water. Um, but that was it. Like it was like hot water and then a translator.
you order?
Like I guess like making sure like tea was part of the order. Like that was something that I
You
did.
you could take credit for like, were there family members there too?
Oh yeah, family members are there too. Yeah.
How was their appetite in general?
Um, like for this one, like ordering tea, hot water, like they would only eat like 50% of it.
So
Like
you
just
could say like you had a patient that spoke whatever language it was, and you noticed that their appetite was poor, and um, you made sure to not only work with the translator to help find foods that they liked, but to also talk with the family when the family was there to really help learn all of their preferences. That they want hot water with their meals and tea, and that they uh, like, being like they have a belief that being cold is not good for healing, and so to make sure to always provide like hot water and warm blankets, and just like be mindful of their preferences, and to make sure you really are giving them like a lot of opportunity to voice what's important to them, so that you
Mhm.
can kind of tailor their care.
Okay.
And you can talk about how like um the most important part of it for you was like just being curious and listening and asking questions.
Mhm.
Do you want to give it a go?
Okay, yeah. For like the most important part of it, like when being curious and asking questions, does that like go under mainly like what I did or like what was the outcome?
Just kind of how you frame it. So you could say, um, I love how area we are lucky enough to have patients from a lot of different cultures. And I found what's most important is to really take the time to listen to them and find out what their preferences are. I had a Cantonese speaking patient, and because I was able to use both the translator and speak with the patient's children, I got to learn that they feel that being cold is not good for healing. And that let me know that to tailor care to them, I can do little things like bringing warm blankets and providing hot water. And initially, the patient's appetite was very poor, but with the help of the translator and the family, I was able to find things on the menu that the patient did like that actually helped us get good nutrition for the patient to help them improve quicker. And the whole experience just illustrated with other cultures how important it is to just talk openly and really listen to what it is that they feel would be the most helpful for them.
Mhm.
Something like that.
Okay. I like that. Oh my gosh, Mary, how do you like get that to flow out so easily for you?
I'm
I'm
so
like
much better on paper
struggling.
with it. When I try to say it out loud from scratch, it always just feels like a bunch of mumbo jumbo. Like I usually have to do it on paper first.
Really? Because like the moment you just like let that out first, I was like, dang, like it sounds like you already like
I've
have
heard
like
a lot of interviews. Heard a lot of interviews.
oh my gosh. I
But I
need
don't
to
want it to sound like too like, because then they're like, she just fed us a line, like
Mhm.
empathy, compassion, resources, and respect. Okay.
Yeah.
Like it's
Okay.
hard. It's like it's really challenging to make it sound like the right amount of polished. It's the
I
hardest.
know. I know. I'm like scared about that because like I feel like something that I'm trying to balance between is like knowing to prepare for the answer so that way like I'm at least not necessarily like well versed, but I have like the sufficient knowledge to present it.
Like
But
bullet
then
points, right?
yeah, but like at the same time, like I don't want to come off like pageantry. So that way, like it puts like this barrier between like me and like a possible hiring manager. And it's like already difficult as is because it's done through Zoom. So I know I have to
It's just
like
gonna be the feeling behind it. Like if you feel like when I was nervous, the words that I tried to remember was like try to project openness and warmth. For
hmm
me, that helped me kind of like not wall off and
hmm
just like feel safe to just genuinely interact with them.
yeah.
Works for you, but like whatever words you found just help you realize like you're just two humans talking to each other, like trying to get to know each
Yeah.
other.
Okay, for sure. Yeah. Like I gotta think about that. Project openness and warmth. Okay.
Yeah. Yeah. I think it's gonna be extra hard with like your competitors listening. And it's like, what do you do when they're talking? Do you just kind of like nod and smile and like be supportive, but not too like
hmm
not steal the floor by being like, yeah, I love that.
I know. And then like at the same time, like for me, I feel like if I like start listening to them, like actually listen, like I might get like too subconscious about my answer and it might like mess me up. So like I feel like I want to like show myself like pretending that I'm listening so that way it doesn't I don't get too into my head. But I know that like something like they were mentioning in the panel is like, oh yeah, something helpful I did is like, oh, like what Mary said, I had a very similar experience, or like I really liked Mary's takeaway because like I found the same thing too with like XYZ.
A little bit
So
of that is okay.
yeah. Um
So do they ask that like one question and everybody goes around, or is it like a different question for each person?
So yeah, so what they do is like they'll ask a question, and then according to my friend, like how it went for her is like they would ask a question and then they'll just randomly call on you. Like there's like no order
You
for who
guys
gets,
all do the same question at the same time, basically?
yeah, pretty much. And then it's like random order for who gets picked on. Yeah. So
Okay.
that's why she was like, yeah, like every time I'd say a story, like I felt like it was kind of getting one-upped by like the person who was picked on afterwards.
Yeah. Have you ever been told to sacrifice quality care for efficient care by a supervisor?
Um, no.
I'd quit.
It's not worth it.
So typically what people say for something like this is, you know, I haven't, but what would be most important in that situation, if I ever do encounter that, is just to express that providing safe quality care is going to be the most important thing for me.
Mhm.
Do we talk about like the creative, innovative one?
No, we didn't. No.
There's a couple different ways people can ask this type of question. Basically, they're asking about a time when like you had to make some sort of change. So it's like, please tell us about a time you had to adjust to a change at work, or please tell us about a time when you had to think creatively or be innovative.
Mhm.
So, you know, a time when something wasn't working, you came up with a creative solution, or like they gave you like a new kind of equipment and you there was like a learning curve, or
Mhm.
like maybe you could talk about like when COVID happened and you had to adapt to that environment with patients, explaining like to keep the masks on, or like any kind of education you provided in like a flu clinic, giving like the COVID shots or any kind of like change.
Mhm. Yeah, I'm like definitely thinking of like when COVID happened for sure. Like we had to like do COVID testing, and like we even had to like yeah, like when we were at the we worked with like DPH and we had to do COVID testing, and like this was like before the vaccine. And even when we had like suspected COVID patients, like we would even perform assessments on them and we had to like report this to the doctor. So that's like one thing that I had to do was like doing COVID testing, also educating clients on their questions about like the moving steps going forward, and then also like understanding the workaround of like working in a disaster relief tent. That was like another cool thing that I got to do too. So yeah, that's an
Oh,
instance.
totally talk about that.
Yeah.
Yeah. Okay, cool.
Yeah.
Yeah, so anything where they ask about like a change at work, where you had to be innovative or creative, or like even a challenge you overcame, you could use that one too for the challenge thing, maybe.
Oh, okay. For the challenge too. Okay.
Yeah. Can you please describe any leadership activities that you've held in your past positions?
In past positions, for this one, like, would they prefer it if like, because I could say like in my leadership experience, like I had to like orient new people like who are working in like the front desk job. That one, or like
This?
what was that?
Which job is this?
This was like for the for both like working as an MA and then also doing the front desk at my school. Like if there was like a new person or like a volunteer, especially at the clinic, as an MA, like I would have to like show them the ropes and teach them for like the
What
first
about the
couple.
disaster relief thing? Did you do it with that? No.
No, because we were only there for like a couple months and then we left. We were done with that rotation.
Yeah. Yeah, you could talk about I would say the MA thing because that's more like medical, like patient care.
Okay. Like orienting, helping out people. Like another thing I was thinking too, like could this one be stronger is like does this show leadership of like when like on the day that we were short staffed, like taking the initiative to help out like other nurses, or like because like or helping out like the nursing assistant. No to that one. Okay.
No, because it's kind of hard to be like a leader while you're like the student. You know what I mean?
Mm-hmm.
Um, I think the other is stronger because it shows like you were so good at your job that you were like kind of the model employee, that they wanted people to be trained like you because you were excelling.
Yeah.
Yeah.
Okay.
Yeah. So a leadership position that I've held in the past is in my MA job. I helped train new employees, and then you take that as an opportunity to brag about like anything you did in that job that might be similar to what you're going to be asked to do on the step down unit. So like I taught them how to use Epic and how to, do the assessments and how to escalate changes in clinical status to the care team, and like anything that like you're gonna have to do, because they'll be like, oh, so she knows how to do this stuff already. Okay, cool.
Yeah. Oh, okay.
um and then you can say that you're looking forward to developing that more, and you would love to become a part of committees to really learn as much as you can from the great resources that are within the hospital, and you would love to become a preceptor eventually, because you really did enjoy the role of like helping new employees get integrated and comfortable, and that you'd love to be a charge nurse as well when that day comes.
Oh, okay.
What kind of environment are you looking for that will challenge you and encourage your growth?
Oh, what kind of environment? Is it kind of like we were talking about a very fast-paced environment?
Yeah, you could talk about all the things that like, like you clearly think you would advance and grow into like the kind of nurse that you want to be versus somewhere else. Like, why do you think that? Like, what are you excited about? Are you excited about like, what?
Oh, I see. Like probably like the fact that like one of their main emphasis is like their care being oriented around customer service and their ability to provide like superior quality care to everyone, regardless of who they are. So just this ability to show compassion to every single patient is like
Be
something that
careful not to say compassion too much, because it was so much stronger what you just said versus compassion. Like anyone can throw around the word compassion, but what you said right before that, it's
Okay.
like, this is what I like about it. Like, this is what I really connect with. And I want to develop especially as I'm a new nurse, to really solidify those values while I'm
Okay.
formulating my nursing style.
Okay.
Yeah. And, they hold themselves to a very high level of excellence in their care. And that is exactly what you want to strive for. And that's the environment that is going to help you become the best nurse that you can be. And that you are really excited to learn everything that you can in rounds with the doctors. And you love that it's a teaching hospital. Yeah, just stuff that you're like excited about that will push you to grow.
Okay. Sure.
Do you know whether you have a preference for day shift or night shift?
No preference, or like do I just say like that? Like there's no preference, like I'm open to
Yeah,
anything.
that's true.
Okay.
Yeah, you could say I'm open to anything. I have a slight preference for whatever, but that you dream is to it, and you will be very happy with a new shift.
Okay.
Can you please describe a time when a patient, family member, or colleague's view was different than yours?
A patient's colleague or family member that was different than mine. Yeah, I had a patient whose view was different than mine. I think this is a really good question because it's taught me the value of, even if there is a patient who may have a different perception or may not agree with a certain procedure or scan, it's really important to tailor the needs after listening to the things that are important to them and tailor specifically to them. And I had a particular patient who had an order for a CT scan. And as the CT scan was starting to near with the time and the appointment that it was scheduled, she started to express apprehension about it and she didn't want to do it, often saying, you know what, I'm hungry because I'm on PO. I just want to cancel it and let me just eat. And so I felt that it was really important to address these concerns, but also recognizing that her hunger may be clouding her judgment because she is so frustrated and overwhelmed with all of these intense emotions. And so I took this as an opportunity to first listen to her concerns, see her perspective from where she's coming from. And then I also took this as an opportunity to educate her on the pros and cons of not doing the procedure. And after being able to educate her, I even paged the doctor and requested if the doctor can come over so that he himself can explain the reasoning as to why the CT scan is needed to help determine why we need it for her to have the appropriate actions moving forward throughout her stay at the hospital. And although she was still refusing, I noticed that from the care that I was providing her previously, that she started humming to some Whitney Houston music. And so I asked her, I said, would you like me to play some Whitney Houston for her just to provide some relief since she was feeling some tension at this point? And she agreed. And so the moment I played the Whitney Houston song, I pulled it up from my phone, I played it, and I just saw this immediate glow in her face. And she just starts smiling and singing. And so I start singing with her and we start dancing together. And it was really cute because we even got the doctor to dance with her too. And it was just a really cute moment. And at that point, it became a breaking point where she finally agreed to doing that CT scan. And so we made sure to communicate this to the transport team. We let the CT scan technicians know, and we even made it known to the incoming nurses during change of shift that this music was really helpful in getting the patient to cooperate and ease a lot of the negative feelings that she had. And just like we promised her that we would have the regular diet restored by the time she came back from the scan. And when she came back, we made sure to greet her with graham crackers and ice cream. And she was so happy when she saw it. And yeah, that's an experience where we had a patient whose view was different. But I think throughout this experience, it really taught me the importance of really tailoring those needs specific to them after especially developing that relationship and rapport with them. And so that was my experience in that situation.
Okay, so that was about 3 minutes. We got to
Okay.
tighten it up. I think you could shave a lot off of the front.
The front, okay.
Yeah, like the question is when a view was different. So you could say, I have, and what I learned was that listening and really understanding where someone is coming from can go a long way in working towards your goals together. We had a patient whose plan of care hinged heavily on the results that we needed from a CT scan. And we had gotten in report that she was uncooperative and refusing a lot of her care. And upon talking with her, we realized that her main concern in this was having to be on an NPO status. And then like just have that be your whole beginning and like see if you can even like shorten that.
Okay.
Because I feel like the meat and potatoes of this is the part about NPO and the music. So you want to get to that as quickly as possible.
Okay.
Yeah. Oh, and then also just like a language switch, like instead of asking the doctor to come over, I would just say you ask the doctor to come to bedside.
Oh, ask her. Okay.
Yeah. I've just never heard it like, can you please come over?
Sounds good for sure. Thank you.
I mean, it's like the same thing, but I've just never heard it said that way.
Yeah, no, for sure. Definitely use like the proper jargon and language for that. Yeah.
But it was good that you kind of like lit up when you were talking about it and you kind of like gave the visual of her like kind of singing and dancing.
Yeah.
and then the doctor, and yeah. And then the ice cream visual was cute too.
Okay, cool. Well, thank you, Mary.
Yeah. Okay, so can you please tell us about a time when you received constructive feedback from a member of your team?
Yes, a time that I received constructive feedback was from my preceptor, and it was regarding being able to do IV meds and priming lines. And my preceptor noticed that I was, after seeing me handle IV skills for a few times, that I was struggling a bit with my dexterity and my efficiency. So for some feedback, she mentioned to really focus on being able to focus on those areas that she had mentioned in which I was struggling. So when I asked her how to improve on that, one of the key things that she mentioned to me is really getting some practice in. And it's really about getting comfortable with clamping and unclamping the lines and major things like that. And so I was really grateful for that feedback because it gave me something to focus on throughout that preceptorship. And so as a result, I really wanted to take the opportunity to get practice on it. And so what I would do is I would come in about 30 minutes early to my shift. And while I would take the time to look into my patients during this pre-lab session, I would also take the opportunity to practice on my IV skills. So I would ask the charge nurse if it's okay to come into the med room and use the Alaris pump and just get a practice in on utilizing the pump, as well as getting practice with using the lines as well. And in addition to preparing during the pre-lab session, I would also take the initiative asking my preceptor if there is any opportunity of us doing any IV meds with our patients, if I could get practice with that as well. And over time, my preceptor noticed a tremendous growth in my confidence and skills in being able to do these IV skills and hanging the meds, priming the lines, getting very well versed with the pump as well and the equipment. And it just felt great from my end too, just seeing the growth in my confidence. Not only did I feel confident doing the skill, but I felt confident doing the skill in front of my patients. So it also improved my interactions with them and overall my time management as well. But that would be an instance where I received constructive feedback, and that was my whole journey and being able to grow in that aspect.
Okay. We're a little over 2 minutes, 17 seconds. Not bad. I feel like that one was better. I felt like you were just like a human talking to me rather than giving me like reciting something that you had rehearsed many times, and like
Yeah.
it wasn't like over polished, which I think is going to be important for them to feel like they connected with you and like got to know you. Because if they don't connect with you, you're not going to be like the one that they're pulling for. You know what I mean? So when I felt like you were actually like talking with me and like just being open and honest with me,
that
was good.
For sure. Okay.
For our next question, can you please tell us about a time when you advocated for a patient, family member, or colleague?
Yes, there was a time when I did have to advocate for a patient. We had a patient who had a discharge order to go home. And both my preceptor and I, we felt a little bit weary about that order because we knew that based off of the nursing assessments, he wasn't able to do his ADLs independently. He was a fall risk. And on top of that, we learned from his sister, who's his primary caregiver, that the patient lives alone and he wouldn't take his blood thinners consistently. And there would be instances where he wouldn't take his blood thinners for 2 months straight and then proceed to take a 2-month supply in a single sitting. And immediately I identified that to be a huge risk because I didn't want the patient to go home for him to take that 2-month supply and then suddenly fall and bleed out. And so once I recognized that, I realized that the plan of care needed to shift for him. And so I had to advocate for him in that sense, where I had to utilize different members of the healthcare team, where I had to reach out to OT to further look into these deficits that he had with his ADLs. And something really helpful that she did is she conducted a mini cog screen on him, where she found that he couldn't even draw a clock. And we found this information to be really helpful because it illustrated this very objective data for why this patient had these certain deficiencies happening with him. And so because of that, we were able to present this to the doctor, letting him know that we had safety concerns regarding the patient to be discharged, specifically going home, and how the mini cog was a case of presenting these deficiencies he did have. And as a result of that, we were then able to reach out to case management, letting them know that per PT and OT, it's best that the patient were to get placed at a SNF unit or at a SNF rather than being discharged home. And so because of that, we were able to get the patient to be placed at a SNF. And by taking by taking the guidance of PT and OT and really utilizing our nursing judgment, we were able to ensure that the patient's discharge was done in a very safe, appropriate, and a timely manner. And that was an instance of us having to advocate for the patient.
Okay. Just like a nitpicky thing, I think you said deficiencies. I feel like the word they typically use is deficits.
Deficits, yeah.
And then I don't know if it matters though. And then there was a part that you had said you wanted to say last time about that I don't know where exactly you'd fit it in to keep it really streamlined and like a tight answer. Mm-hmm. But the part about how talking with the sister and then like once you did the workup, it really reinforced the importance of not being dismissive of concerns that family members raise and how they can actually be a really important added layer of safety if you listen to what they have to say and like use that to help keep your patient safer.
Mm-hmm. Oh yeah, I know. I totally realized. I was like, oh crap, I didn't mention that like in my flow. Okay, but yeah, I'll totally remember that now.
Let's see. Can you please tell us about a time when you needed to escalate a situation or concern quickly and efficiently?
Yes, the time that I needed to escalate a situation was when I was in the patient's room and I was doing an assessment when I noticed that the patient had this left-sided facial droop that was new. It wasn't mentioned in report and it wasn't part of the patient's baseline assessment in the notes or charts. And so quickly I did a full neuro check just to see if the patient was fully oriented and alert. And I took these findings and I presented it to my preceptor, letting her know that I did a neuro check and I noticed that the patient had a deficit of a facial droop, but no other neuro changes. And because we both quickly suspected that it was a stroke, we immediately called for a code stroke and I was able to page the stroke team. That would then notify rapid response, also letting the primary team know as well. And while I was with the patient, also made sure to take some preventative or cautionary measures, such as checking if she had any IVs to make sure that in case if anything had escalated. And then I also had, because the nursing assistant happened to be there, I also had the nursing assistant grab a glucometer for me and I was able to get a blood sugar, draw some labs as well. And once the team was over, because the doctor was communicating and explaining things to the patient, I just felt that it was a very overwhelming and intense situation for the patient. So I took that as an opportunity to hold the patient's hand just to provide some emotional support as well. And once we were able to perform the appropriate interventions and assessments, the stroke team was able to take over and they were able to bring her down for a CT scan where they found that she indeed did have a stroke. And so that was a case at which I needed to escalate the situation quickly and we were able to then have the appropriate resource and team takeover, in this case being the stroke team. And so that was the case of that.
Okay. Just so you know, if your patient has a stroke, or has some suspicion of a stroke and they need to go to CT, you or like the primary nurse has to go with that patient.
Right.
What you do is you tell the charge, can you please watch my other two? I'm going to go downstairs with her because and it's like, why wouldn't Rapid go with them? And the idea is like, if you're downstairs in CT and there's a code blue for another patient, Rapid would have to abandon your patient. who like
Yeah.
maybe just had a stroke and might become like
Okay.
active or something. So the primary
Okay.
nurse always goes to CT.
Okay.
You could just say, the results of the CT, we were able to make sure this patient had a CT done very quickly, and the CT did show that she had a new stroke.
Okay.
However you want to say it, whatever you're comfortable with.
Okay. Sounds good. Thank you, Mary.
Can you please tell us about a time where you needed to delegate a task to a member of your team?
Yes, a time that I needed to delegate a task to a member of the team. This was during a stage in my preceptorship when I was providing primary care for 2 out of the 3 patients. And one of our patients had a potassium level of 3.3. And after paging the doctor and letting them know about that potassium level, we got a stat order of potassium. And right when I was about to give the med with my preceptor, the charge nurse lets me know that one of the other patients that I'm providing care for, who is an elderly and confused patient that is also a fall risk, just had a loose bowel movement and immediately wants to be cleaned up. And so quickly, I identified this to be 2 situations where they need 2 patients that needed to be immediately tended to. And my initial goal was to delegate the nursing assistant to check in on the elderly patient who just had the bowel movement. But after learning that the nursing assistant was present helping another nurse, I let my preceptor, or not my preceptor, my charge nurse know about the situation, letting her know that I have 2 urgent situations that needed to be tended to. And if it's possible, if she can either give the potassium to the patient or check in on the elderly patient. And
So last one, can you please tell us about a time when your patient's plan of care suddenly changed?
oh, shoot. I think I may have messed up. I think I used the discharge story. That was supposed to be for the plan of care.
Was that, when did you say that one?
I think I said it for the advocate one. I said it for the tell me about a time.
Advocate, you did the discharge one. Oh, I see.
Yeah. Oh shoot.
What
I
other
think
critical patient stories did you have? Were there any more? What are your other favorite stories?
um other favorite stories.
What you got left?
Um I think we were mentioning, but we are like, oh yeah, could be stronger about the patient who was like an elderly patient and he had he was like very confused and had an altered mentation, and we realized that it's probably because he was on a bunch of opioids and narcotics, so it was best that like we shifted his pain management to something else. But I do remember we feeling a little bit about that story where it could have been something stronger.
For this one, they say they want prioritization, delegation, resource utilization, and escalation. Um, and the other one was advocate. Is that when you wait? Sorry. So the discharge one, what did you use that for?
We said that to advocate because we were advocating like, oh, he shouldn't go home and said be placed at a sniff.
I feel like, so what other stories do you have about when you advocated for somebody? Like anything like a story where you got a patient what they needed?
What a patient what they needed. Besides like the discharge and the music listening one, got a patient what they needed. Um,
Where you like recognized a need and you were the one that like got them their favorite thing that they like or whatever it was.
mm,
Like, do you have any like super sweet stories with a patient?
I know. I'm thinking, well, like going back to like the patient who was really confused. Like once we got him off like the opioids, like it was really cute because like once like the wife came over, like he became such a total sweetheart. And he was like I was able to like he became a lot more compliant with me. Like he would ask things like, "Oh, can you grab me a warm blanket?" or "Can you grab a seat for my wife who wants to be with me?" And I would do things like that, and he would like be really thankful and appreciative towards it. And it was like really funny because he was like, "Today I'm celebrating my 50-year anniversary with my wife," and he was like so cute. He was like giving like the example, like the advice of like the key to a successful marriage is to know when to shut up. So like that's something that really struck with me.
Did you ever look up if Oxy was on the Beers criteria?
On the what was that?
The Beers criteria, it's like a list of medications that older adults should not take because sometimes they have like bad reactions to them.
Oh, no, but I can look it up right now.
Because maybe you could talk about like advocating, right? So this patient had pain or whatever it was, and then you had heard from the family that this change in behavior happened when he started taking the oxycodone. So you advocated to try a different medication that's more appropriate for, that might be more appropriate for him
Mhm.
based off of what you had learned about the Beers criteria. And there was such a night and day difference trying the other medication, and that the wife was, amazed to see how he was
Mhm.
suddenly back to baseline. And you talk about how he was like cooperative and you were able to provide the care that he needed once he was no longer disoriented.
Mhm. Okay.
Maybe because then you're advocating and it was a good outcome.
Yeah. No, for sure.
Do you want to start going through other questions they might ask you?
Okay. Yeah.
Uh, okay. Um,
Should I use like different stories at this point, or is it okay if like
try
we
to
try to? Okay.
think of anything else because you're kind of really limiting yourself if you only have like 5 or 6 stories that you like, because if
Mm-hmm.
they throw you a curveball, it's going to be hard if you've already told like the story that would fit for that.
Yeah.
Yeah.
Totally.
Just try to think of like anything you did that you like want to brag about,
Mm-hmm.
you know?
Okay.
Um, so that's it for the questions that we have for you. Are there any questions that you have for us before we finish today?
Yes, I do. Try to open up the things that you shared with me. Um, being able to ask, if I were to get the job, what would be the best way for me to prepare in the meantime?
Okay.
Other one, yeah.
Have like 3 just in case somebody steals your answer before you say it.
Oh, okay. Or like, what is the patient population? What is involved in the new grad training process? And then, oh, like with like I remember like something that we talked about like together, like during being in clinical with you, was like asking like, oh, what are your goals on the unit? Or would that be more like goals like unit specific, like for the unit interviews, not
Yeah, you
necessarily.
could say like, what goals are you currently working towards on your unit? Because it's going to be hard if I think you're going to be interviewed by a bunch of different units, right?
Yeah. Mm-hmm.
So that makes that question a little bit harder.
Mm-hmm.
Um, you could say, yeah, because then it's like, well, we don't really have time for each of us to go through for our unit. You know what I mean? Same with the patient population question.
Yeah.
Um, I think, can you please share a little bit about the new grad training process? I think would be a great question.
Mm.
You could ask, I think the best one is going to be, if I were to get the job, what would be the best way for me to prepare in the meantime?
Okay.